1. Which of the following is the primary goal of infection control in a dental practice? A. To reduce operational costs. B. To prevent the spread of infectious diseases. C. To improve patient comfort. D. To minimize the number of dental procedures. 2. What is the most effective method for sterilizing dental instruments? A. Boiling water. B. Dry heat sterilization. C. Autoclaving. D. 3. In the context of infection control, what does PPE stand for? A. Personal protective equipment. B. Professional patient engagement. C. Preventative personal education. D. Primary protection equipment. SOR. Which of the following is considered a critical instrument in infection control? A. Scissors. B. Needle. C. Handpiece. D. Blood pressure cuff. 5. Which of the following is a correct procedure for hand hygiene in dental settings? A. Wash hands for at least 15 seconds. B. Use soap and water when hands are visibly dirty. C. Disinfect hands using an alcohol-based hand rub only. D. Wash hands only after patient interaction. 6. Which of the following is a characteristic of an ideal disinfectant? A. Only effective against certain pathogens. E. Does not cause skin irritation. C. Requires long exposure times to be effective. D. Is ineffective against blood-borne pathogens. 7. Which of the following personal protective equipment, PPE, should be worn when handling contaminated instruments? A. Gloves and face shield. B. Gloves, mask, and protective eyewear. C. Gloves only. D. Gloves and gown. 8. What is the primary purpose of the standard precautions in infection control? A. To ensure patient comfort during procedures. B. To prevent healthcare workers from acquiring infections. C. To prevent cross-contamination between staff members. D. To protect patients from contamination. 9. How should contaminated sharp objects be disposed of in a dental office? A. In regular trash bins. B. In a puncture-resistant sharps container. C. In a biohazard bag. D. By flushing down the sink. 10. What is the purpose of an autoclave in dental infection control? A. To clean dental equipment with chemicals. B. To sterilize dental instruments using high-pressure steam. C. To disinfect surfaces in the dental clinic. D. To dry instruments after cleaning. 11. Which of the following is an acceptable method for cleaning a dental surface contaminated with blood or saliva? A. Wiping with a damp cloth only. B. Using a disinfectant wipe approved for blood-borne pathogens. C. Spraying disinfectant and leaving it untouched for 24 hours. D. Rinsing with water alone. 12. When should gloves be changed during dental procedures? A. After every patient interaction. B. After touching non-contaminated surfaces. C. When gloves become visibly soiled or torn. D. Gloves do not need to be changed between procedures. 13. What is the recommended time for disinfecting dental surfaces after contact with potentially infectious material? A. 5 minutes. B. 10 minutes. C. 15 minutes. D. 20 minutes. 14. Which of the following items should be included in a dental office's infection control policy? A. Guidelines for staff uniforms. B. Guidelines for cleaning personal items. C. Procedures for handling patient medical records. D. Procedures for sterilizing and disinfecting dental instruments. 15. What is the role of the dental assistant in infection control during a procedure? A. To monitor patient vitals. B. To ensure proper sterilization and disinfection procedures are followed. C. To manage the financial aspects of the procedure. D. To prepare patient education materials. 16. How should contaminated clothing such as gloves be removed to prevent contamination? A. By pulling them off from the wrist. B. By pulling them off inside out without touching the outer surface. C. By removing them in front of the patient. D. By shaking them out before disposal. 17. What does the bloodborne pathogens standard require employers to provide? A. Training on infection control procedures. B. Regular health checkups for staff. C. Financial assistance for medical treatments. D. Emergency evacuation plans. 18. How often should dental office staff undergo training in infection control? Once every 5 years. B. Once a year. C. Only when hired. D. Only when a new disease outbreak occurs. 19. What is the correct procedure for cleaning dental equipment that cannot be autoclaved? A. Use alcohol-based disinfectant. B. Use chemical disinfectant approved for non-sterilizable instruments. C. Soak in warm soapy water. D. Wipe with a wet towel. 20. What should be done if an autoclave fails to reach the proper temperature? A. Replace the sterilizer immediately. B. Report the malfunction and re-sterilize instruments. C. Continue using the autoclave until it's fixed. D. Store instruments unsterilized. 21. Which of the following is an example of a blood-borne pathogen? A. Herpes simplex virus. B. Hepatitis B virus. C. Influenza virus. D. Strep throat bacteria. 22. Which of the following is a recommended practice for infection control in the dental laboratory? A. Wearing a lab coat and gloves at all times. B. Disinfecting all tools only after the end of the day. Leaving all items in open containers to dry overnight. D. Using the same gloves for multiple procedures. 23. Which of the following is a true statement regarding the handling of contaminated laundry in a dental office? A. Contaminated laundry should be left uncovered for 24 hours. B. It should be placed in a red biohazard bag for disposal. C. It should be washed with hot water and bleach. It should be laundered by a professional cleaning service only. 24. How often should dental instruments be sterilized? A. Once a day. B. After each use. C. After every patient interaction. D. Once a week. 25. Which of the following is the most important action in preventing the spread of infectious diseases in a dental office? A. Frequent hand washing. B. Cleaning the office every week. C. Limiting the number of patients per day. D. Using disposable instruments only. 26. What is the correct temperature range for an autoclave to effectively sterilize instruments? A. 50 to 60 degrees. B. 100 to 110 degrees Celsius. C. 121 to 134 Celsius. D. 140 to 150 degrees Celsius. 27. What does the term cross-contamination refer to in a dental setting? A. The accidental transmission of pathogens from one surface to another. B. The intentional transfer of disease from one patient to another. C. The use of contaminated instruments for cleaning. D. The safe disposal of medical waste. 28. Which of the following should be done to protect patients from infection during a dental procedure? A. Use sterilized instruments and gloves for each patient. B. Rinse patient's mouth with water after every procedure. C. Provide patients with disposable face masks. Ensure all staff members wear glasses during procedures. 29. When should the dental assistant perform a post-treatment cleaning of the dental operatory? At the end of the day. B. After each patient. Once a week. D. Only when visibly soiled. 30. Which of the following best describes the procedure for cleaning dental radiography equipment? A. Wipe with a dry towel after each patient. B. Use a disinfectant wipe approved for the equipment's surface. C. Rinse under running water. D. Submerge in a disinfectant solution. 31. Which of the following is an important step in infection control when handling dental X-ray films? A. Place films in open containers before development. B. Use gloves when handling films, both before and after exposure. C. Leave films in the open air until ready for processing. D. Only disinfect the X-ray machine after each use. 32. How often should dental staff be screened for tuberculosis? A. Once a year. Every 5 years. C. Only after exhibiting symptoms. D. Once during employment. 33. Which of the following is the best way to prevent the transmission of pathogens through air in a dental office? A. Install HEPA filters in the ventilation system. B. Use disposable instruments only. C. Ensure all surfaces are wiped down frequently. D. Close all windows and doors during procedures. 34. When should a dental assistant clean their work surface? A. After the procedure is completed. B. At the beginning of each day. C. After every patient interaction. D. At the end of the week.